I'm Dr. Erin Elliott.
And I'm Jason Tierney.
I'm a dentist.
And I'm a dilettante. And we're going to talk about sleep matters because
sleep matters.
Erin Elliott.
How's it going?
Where in the heck are you right now? You don't look like that. You're at. You're usually dialing in from a beach somewhere.
Yes, or home, or I am again on the road. However, I am continuing my education and learning. I'm down in Scottsdale for some CE, soft tissue grafting.
Riveting.
It is, but I just had I had this to look forward to all day, to come over to your house so that we could podcast in person.
And yet I'm in the same place that I always am. And you are.
I'm in your living room.
And you're in my living room.
And we're sending Tom to get us some lamp pizza.
Yes, Tom will be our pizza delivery boy.
I love lamp.
I just hope, yes, that's what their T-shirts say, actually, is I love lamp. Let's just hope that when I called into pizza, I didn't order it with extra anchovies like in the movie Loverboy, I think it was, and Tom shows up. Anyway, if you haven't seen the movie, go check it out, and then you'll spit out your water. But hey, we have our most patient guest ever. Not only if this dentistry thing that works out for him, can he be a model, but he is also the most patient guest we've ever had. We had some tech issues, and Dr. Anthony Bolamperti, sorry.
That's perfect. Well said.
Yeah, sorry. And the worst part is we've actually met before, and I still can't get your name right.
That's all right.
But nonetheless, thanks for joining Erin and I here on Sleep Matters.
Yeah, I appreciate the opportunity. Thank you.
Yeah. So when Erin suggested that you join us, I was like, I know that guy. I met you at a sleep course probably 12 years ago or something like that. And she said, yeah, well, he is a huge proponent of laser dentistry for using laser for a number of reasons, one of them snoring. But why don't you tell us a little bit about who you are and why you're here talking with us?
Yeah. Well, I appreciate the opportunity, and it's great seeing you again, Jason. That was years ago, back when you were with, is it Sleep Solutions or something like that? And it's amazing how my practice has transformed to where it is today, because I was trying to do laser dentistry back then. I just didn't have the right laser system. And so, when you finally get the right system, the right technology, things really just take off. So, being here in Omaha, Nebraska, we're loaded with dentists. The Midwest is a little bit behind the times with technology. And I've been trying to become the laser guy in Omaha, Nebraska for the past 20 years, and failed multiple times because I didn't have the right technology. And so, the CO2 is unbelievably by far the best technology. I can say that because I've tried them all. And it's really transformed my practice into something I never thought I would get into, which is airway and treatment of tethered tissues from babies to adults. So I'm very blessed and fortunate to be in this predicament and situation. And I love what I do, and it's an amazing transformation of the old days when I had my business as Optimal Health Dental as Drill, Fill, and Bill, until now we are Omaha Laser Dentistry for the past 10 years, and really have developed a niche of being the laser doctor in Omaha, Nebraska, who is, really specialized in treatment of tethered oral tissues.
So you mentioned, kind of going through the process of identifying the right system. Can you just talk a little bit, for the people that are on here that are maybe getting ready to start on that journey, how can you help accelerate the process for them so they can skip a lot of that pain and
Right.
get to where you are faster. Of course, not
Right.
to be not to be the number one in Omaha. We don't have any listeners in Omaha, but elsewhere, right? Outside of a
Right.
50-mile radius. How can you help? What would you share with them to help accelerate the process?
I talk to dentists throughout the country when they are trying to figure out if they want to start this journey. And my basic question to them is always, what do you want the laser to do for you? How do you want to take this? Do you want to take it to a different level? Are you a general dentist? Are you a specialist? Are you focused just on airway where you just want to do soft tissue? So most of the dentists I talk to are general dentists. And, with that, I kind of just let them know, study the science. You can't dispute science and how that wavelength, whether an erbium or a CO2 interacts with the chromophore target tissue, will dictate how successful that energy is with what you're trying to achieve. So some dentists don't want to get into hard tissue, simply soft tissue. So don't waste your time and energy getting into an all tissue laser. Most dentists want to get into to hard tissue, but they love the soft tissue components. And they're very interested in airway, snoring. So it always kind of boils down to what they want to invest in as far as what they want the laser to achieve for them in their practice.
Got it. Erin?
So you would save them a lot of time and energy by just telling them which one to get. For
Yes,
those of
exactly.
you listening, I I have had a Celea since the end of 23, was it?
Yeah. Yep.
Yeah. And so we made the jump, and I really feel like it was the perfect thing for all the procedures we already do. But now I've added procedures I wasn't doing and really added some tools to the tool belt of how to help treat our sleep patients that are already in our door. Um, and so little did I know that when we decided to have the trainers come to our office, because to us it's really important to get the whole team on board, they sent Dr. Bolamperti, who happened to be my instructor at Creighton University Dental School my freshman year. So in 1995, I knew him back then and got to be reconnected with him. And yes, his hair was that good even back then.
Yeah.
I'm blessed. I'm very
And
blessed. Thanks, mom and dad.
and I don't know if he knows this or not, but he's my mentor even with this. So just a quick story about tethered tissue. I knew it was important to airway. I just didn't understand how important. So I had a friend who, Tucker, he's a drywaller, and this is what really, he's not into voodoo or woo woo stuff or anything like that. He's a drywaller. And about 10 years ago, when I first met him, I was like, dude, you have sleep apnea. Come to my office. And sure enough, he did. He got an appliance, loved it. And I was like, while you're here, I see that you're tongue tied. Let me go ahead and do a release. Just, maybe you'll get a girlfriend or something. So I took my trusty old $3,000 diode laser and fried a few fibers and sent him on his way, thinking that was a tongue tie release. So fast forward, Tucker saw me one day and he's like, "Hey, remember when you did that tongue tie thing? Will you do it again? Can I get more?" And he had been doing some reading because he was having some TMD pain and his dad was dealing with it. And he's like, "I don't want to end up like him. And so can we do more?" And I was like, perfect timing because I have someone come into my office. And the big thing too is that I had a hygienist who was a myofunctional therapist, and that is probably Dr. Bolamperti won't even do a release without it. And so in coordination, I got to really see what a functional frenuloplasty was. And it was a whole lot different than I thought. So now Dr. Bolamperti is my mentor. I want to learn all things from him. I'm going to his course in June. I've already flown out to his office. I'm going again to learn from him because I just want to be confident. So saying that, Dr. Bolamperti, could you talk about really the difference between I was telling them earlier, it's such a disservice to patients who think they got a release and they
Mhm.
didn't.
Yeah.
Mm.
And so could you kind of explain the difference and what makes yours so much different?
Yeah. Yeah. And I've believe me, the only way that you can get really good at this is if you take that step into it and dive into it and start doing releases, but you have to have that education to back you up. And I have my failures back when I had a diode like when you would send some fibers, go, you're good. And they could move their tongue and that was it. No mention of myology, no mention of, fascial release or craniosacral therapy or anything. And then even with my erbium, it was frustrating because I still wasn't doing myology and just doing superficial releases. So it wasn't until I came across a myologist here in Omaha and started working with her and just really kind of learned from each other, just kind of ebbed and flowed and just asked questions and sat in on some of her courses or just some of her training sessions. And, it really perfected my technique. And I did take Zagi's at the Breathe Institute, have to drop his name. But when I took his course, it was just after COVID and I was already doing releases. And I acquired some of his things and I said, I like my technique. I like my laser, but I'm going to take some of his things. So, it's kind of a hodgepodge of what my education brings full circle,
Mm.
but it definitely has perfected my frenuloplasty, as you say. So the difference between a frenuloplasty and a frenectomy is one, the frenectomy is very superficial. You don't dive into that deep muscle. You leave a mucosal layer of fascia. So there's still a lot of fascial fibers that aren't released. Um, Working with the myologist is key. The myologist is like the PT of the oral cavity. They get that tongue ready for the release, right? They promote tongue posture, tongue tone. And you really have to make sure that the patient's a candidate for a release, meaning do they have tongue space? Is that palate wide enough? Um, and then really just going through the myology and kind of reestablishing better memory for that tongue because the tongue's a muscle. We forget that. And it's an organ, so it has multiple functions. And so, reestablishing the tone of the tongue and the memory to posture for optimal breathing. And then when you go and you do a functional frenuloplasty, the tongue postures as you had trained it. And then they see the myologist thereafter. So the frenectomy is more of a superficial release, not truly in depth, where the frenuloplasty is, man, you're getting into that fascia, releasing those deeper fibers that the myofunctional therapist could not release, and just kind of separating that from the muscle when you're dealing with the lingual from the genioglossus muscle. The maxillary labial, I always do that with my tongue. I want to promote nasal breathing. So I'm promoting that release beneath the nose. And patients always comment that one, lip seal is a lot better. And two, breathing through the nares is open way more because that tension is gone under the nose and they feel they can incorporate more breathing through the nose because that tension's gone. So we're really promoting nasal breathing, tongue posture, rest, sleep, and from there it's the whole body too, because it's amazing how the whole body is impacted with this fascial release.
And that's the big thing is the fascia, right? If you look at a cadaver that's been dissected out, the fascia all begins here and goes down to the toes. And in my initial training, online tongue release training is not awesome, but it's what I had.
The start.
And yeah, but you're watching videos of kids getting a release and they're like, whoa, my legs feel lighter. Like
Yeah.
kids don't know how to lie. So if their legs are feeling more released, it's awesome. So I'm just going to read some of Tucker's text to me was, bro, this is bananas. So I've had some weird positives that have happened already. I always have a nervous stomach every morning, which hasn't been there the last 2 days. I've always had sinus and ear congestion, and now my ears are draining like crazy. I can touch my shoulders to my traps or something like that. I can move my head a lot better. It feels like it's starting to slowly untense all the muscles down my body. My migraine brain fog stuff is non-existent. So in the context of, so yeah, that's awesome. muscle,
Yeah.
neck, shoulder, all of those things are released. But in the context of sleep apnea, why would this be a tool in our tool belt for our sleep patients?
So, sleep apnea and like snoring is multifactorial. And, I think it's wonderful to understand all the, all the things in your toolbox that you can treat your patients, whether it's an appliance, whether it's releasing with tethered tissue, whether it's Soleil asleep and you're just trying to tone and tighten that collagen. It's nice to have a full box of tools because everybody's different. Everybody wants a different, um, say, outcome. They maybe have different expectations. And so some don't want to go the surgical approach of going to see the myologist and treating with the release. So maybe just Soleil asleep might give them some relief or an oral appliance. But when I talk to patients, my big thing is when they have sleep apnea and they've been diagnosed and they're wearing the CPAP, and I ask them, I say, well, why do you have sleep apnea? And they say, well, I did a sleep study. I go, I know that's pretty obvious, but the physician gave you a CPAP. Did they talk to you about why you have sleep apnea? Well, no, they said I took the test and I failed. And I said, okay. So no one looked at you and said, this is why you have sleep apnea. And so I always dive into it and say, well, diet and exercise first. You look like a healthy individual. Your medical history is unremarkable. You have some hypertension, but you're in shape, maybe a little bit, a couple pounds overweight, according to the BMI. Everybody's overweight. But generally you're healthy. And skeletally, you're not so class 2 that your jaw's in the back of your airway. So why do you have sleep apnea? So, and that's when I dive into tongue and posture and how we breathe. And then I take intraorals and I show them the tethered tissue. And I say, and I have a diagram and I show them how their tongue will obstruct that airway if they're mouth breathing, how if it's on the floor of the mouth, the posterior part of the tongue will block the airway, especially if they're laying on their back. And I said, all we need to do is get a myologist, retrain that tongue to posture forward. I'll do a healthy functional release and you'll see them after and your tongue will posture forward out of the airway. You'll breathe through your nose and you'll feel like $1,000,000. And patients are always like, man, no one explained it in that detail. I go in greater detail, of course, but no one has ever taken time to explain the anatomy to me and why I have sleep apnea. So I think really that, the point of what I like to explain to my patient is education. Like Erin, I'm a huge educator. I love to educate patients. I had a new patient in this week and she came in and saw my Google reviews. She had a couple broken teeth and I didn't really even address the broken teeth. I said, what's your complaint? She goes, I don't sleep well. So we spent 45 minutes about tethered tissue. She has a CPAP. We talked about that, sleep apnea, the cause of that, how I can change her life. I said, we'll have you come back and I'm going to put like a big resin on those 2 broken teeth, but we're not going to worry about crowns or bridges. Let's focus on your health. Let's focus on your sleep. And she was in tears. She's like, I love your approach. I'm all in. Where do I go? So, patients need sleep. That's the biggest epidemic we're having right now in this country, probably elsewhere, is that people aren't sleeping and no one's giving them answers. Taking a sleep test and giving them a CPAP or just an oral appliance, we got to look beyond that. We got to dive in and say, what's going on with this person?
You mentioned that she read your Google reviews, and on your site, you're promoted heavily as a laser dentist, right?
Yeah,
Uh,
yeah.
so how do patients reach out to you specifically because of laser? Um, or how has that benefited the business of your
Sure.
practice?
Sure. And laser is one of those things when my wife and I came up with Omaha Laser Dentistry is like, that's kind of intimidating to some people because they think laser like, oh my gosh, it's out of control and it's all over the place. Um, but really, especially nowadays, people are wanting a better way to do dentistry. They want something better than the drill. And so we get a lot of patients who, pull up laser dentistry. and boom, there it is. They want something that is not as traumatic. They don't want to be numb, right? So they're looking ways for an improvement in the technology that was so barbaric that's terrified them as children. And they want a better approach that will be less traumatic, better results, not just for them, but for their children. So laser dentistry is definitely one of those things that, is promoting and a better way to appeal to people who are terrified of the dentist. Because, I mean, we're not looked on as saviors, right? We're looked on as like, wow, you're a dentist. I don't like being here, right?
Sure.
And if you can do dentistry in a different limelight where there's less trauma, whether it's surgery or whether it's just restorative dentistry with no anesthesia, it's a game changer. And that's what it's been for my practice. It's just blew up in Omaha, Nebraska, that we get patients from all over the place who drive 2 hours for restorative dentistry or for treatment of tethered tissue from babies to adults. So it's definitely something that's enticing to people nowadays because they want change. They want something better.
Absolutely. It is a practice promoter for sure. And like I said, the Swiss Army knife for a lot of the things I'm already doing. I wanted to mention too, when you were talking about the maxillary release, it's everyone, you need to see, you need to see how he does it. It is not just cutting the frenum. I mean, it is releasing the muscle. I have pictures, but that doesn't help you on a podcast. So I don't know where to send them to look because if you talk about maxillary release, they're just going to show you a frenulum or, just cutting the frenectomy.
Yeah.
Also saying that, I struggled. I knew I wanted to be all in on this. My hygienist is the myofunctional therapist. I mean, we have a pediatric program. We were all set up in my practice, but I didn't know where to go learn. And there was an online course that was suggested to me, which is great. It's a great starting point, but that's not enough because there's a lot of anatomy under the tongue. I do full arch extractions and alveoloplasties and flap them open and extract teeth and place implants and all the things, but under the tongue is even more scary. I always say I'm ready for the release. I have my Depends on, let's go. But, um, so Dr. Bolamperti, like I said, I'm like, you're my mentor, whether you know it or not. So
I appreciate
I
that.
am excited to announce that
Drum roll.
finally, yes, you can go learn from Dr. Bolamperti in Omaha, Nebraska. So I am signed up, ready to go June 5th and 6th, but there's plenty of opportunities. The There's only 4 or 5 dentists allowed max.
Yep. Yep.
So it's a really good, close-knit learning environment and get to go out to dinner with everyone. So I'm excited. But if people wanted to learn more about your course and they're interested in going down this path, where should they go to do so?
They could email me directly and I can send them the link to check out the course and register at Dr. Tony, so DRTONY at Omaha Laser Dentistry. I hope you all know how to spell Omaha. I know that's often misspelled. And laser is LASER. We all know how to spell dentistry, but Dr. Tony at Omaha Laser Dentistry. And I'd be happy to send them information on the course. And it's been a great, we've getting doctors who are really signing up, and it does fill up quick because they are only allowing 4 to 5 doctors per session because we want it to be intimate. We want doctors to feel valued. We want to have the integrity of the subject, right? Tethered tissue. We want to stress the importance of the anatomy so they're not terrified going in under the tongue. But to feel confident in just having a conversation with their patients when they go back to work Monday morning, talking about nasal breathing, right? Talking about tongue posture and evaluating their patients who might be candidates for a release, a frenuloplasty, but understanding the importance of myology, right? Which a lot of people miss that. How many times I hear about surgeons doing a release of Z-plasty, and I'm like, who did your myology? And they're like, what's a myologist? I'm like, okay, it failed. Might want to come see me because it failed. I can guarantee you. But, I'm just very fortunate and blessed to have this course. My wife and I, my wife is amazing. She came up with a lot of this content with just by listening to me and taking some of the courses. And it's definitely full of knowledge. Mystery creates fear, knowledge is power. And our goal is to educate these doctors so they feel more empowered to look at patients in a different limelight and to treat accordingly.
And you really
Excellent. And
can't unsee it. Oh, sorry.
no,
I
please.
just now when I look at patients, no, I look at the public. You can see
Yeah.
mouth hanging open, forward head posture, and then I'll be driving down the road. I'm like, "Where's my tongue right now?" It's in
Yeah.
it's where it should be, and we take it for granted. And when I do an exam for a sleep patient, I'll call out, generalized wear, forward wear pattern, um, dental cupping, acid erosion, low tongue posture.
Yeah.
It seems to be quite often. So I have kind of an abbreviated test. Not everyone with low tongue tone and low tongue posture needs a release.
Right.
And so those are all the things that I think are important that we as dental sleep medicine providers are aware of and are looking for.
Hmm. Yeah. Absolutely. Yeah. And I think that's important to understand. Like, once you see it, you can't unsee it. And so you start doing your exams totally different. And it's almost like sometimes I'll see a patient and I'm like, oh, geez. Yep. Okay. There's wear on the lower anterior. They've got tori and they've got a scalloped tongue and excessive rugae. I'm like, all right, let's do this. And I'll bring those words out and then I'll say, how's your sleep? And the next question is, what do you mean? I go, how do you sleep? Pretty good. I go, well, do you mouth breathe or nasal breathe? And then it just comes out. They start just talking about, well, I'm a snorer. My wife says I snore. I wake up, my mouth's really dry. And I don't sleep well. I go to bed at 10 o'clock and I wake up at 6, but I wake up and I'm exhausted. I'm like, okay, so you're a restless sleeper. Welcome. you know. So and then the conversation just goes in and I start showing them the anatomy of what I described. And for when I hire a new assistant, it's like I'm speaking French. I really have to explain to them what these terms are so they understand and know how to spell it in our notes. But it's definitely eye-opening to patients, and patients are really appreciative to hear someone who finally listens and can have an answer for why they don't sleep well.
Can't you see he's an educator at heart? One of the biggest light bulb moments I've had in the past years, so this made a big impression on me. When you said excessive rugae, could you please explain what you mean by that and why that would be a sign?
Yeah, so excessive rugae, we have rugae in two places as far as I know. We have it in our intestines, our small intestines. That helps to digest our food. We also have it on our palate. Now, we want it in the anterior third of our palate. We want it right by our incisive papillas on the lingual of 8 and 9. If we have excessive, it floats more posteriorly to about a third of the way, 2/3 of the way back. Not 2/3 away, but it doesn't go back to the soft palate, of course. That's way too much. But it goes back to about where that palate starts to bubble up. And that's called excessive rugae. So rugae is the sensory positioning of our tongue to locate, to start our swallow, but also to position to open up that posterior airway. So if someone has excessive rugae, I will always show them their excessive rugae and say, I think you pivot your tongue back here more. And so I'm looking at them and their mouth is closed. And I say, for instance, where's your tongue right now? And they go, it's right where you said it was. I go, exactly. If you swallow and their tongue goes to swallowing to that tongue on spot behind 8 and 9 and starts to swallow and hangs out up there most of the time, we wear that rugae away every time we swallow 2 to 3,000 times a day. When we have excessive, that tells me their tongue posture is more posterior and not as far anterior. So there's an airway issue.
As you're talking about this, I'm thinking this could be like one of those, those like magicians on the street in Vegas. Like
Yeah.
you could do this. It's like, hey, let me guess where your tongue is postured right
Yeah.
now and how much
Yeah.
rugae you have.
Yeah.
And then
right.
and then all the crowd gathers around. They're like, no way, he's right. Yeah.
Rugae is a homing beacon for our tongue, and if it's
It
not
is.
worn away, your tongue's not there enough.
It satisfies
Cool.
the vagus nerve. It's a dopamine releaser. It's endorphins. It's the spot to be. So yeah, absolutely.
All right. We're going to play a little game with you. But before we do, just one more time, can you tell everybody how to contact you to learn about the courses?
Yeah, absolutely. It is Dr. Tony, so DRTONY at OmahaLaserDentistry.com.
Excellent. We'll get those put in the show notes as well. And everybody check out those courses. But first, we're going to play a little game called The Final Countdown. All right. So we're going to ask you a few questions, and you've got a grand total of 20 seconds to answer those questions. Are you ready?
Is this for me? Okay.
This is for you.
All
Yeah.
right. Let's
All
do
right.
it. Let's do it.
Let's do it. If money didn't matter, what would you do for a career?
Oh, geez. I live on the beach.
That's not a job, but all right. Number 2, what's the worst movie of all time?
Gosh. The Hillbilly movie in the 70s. I can't think of the name of it. With
Yeah. Deliverance.
Yeah, Deliverance. Yes.
All right. Number 3, do you believe in ghosts?
Yes.
And finally, you're going to enter the ring for the Battle Royale. What's your theme song?
Final countdown.
Well said. Dr. Bolamperti, thank you so much for being here and talking about laser dentistry and sleep matters because it matters. So I hear.
Sleep matters.